Welcome to my YouTube channel. Myself Gaurav Prakash, a student of second year MBBS from MMCH Bihar. Today we are going to discuss on the topic cubital fossa, which is a very important topic from the upper limb question, important for the university exam also. So let's start. Before reading the cubital fossa, we will discuss on the different headings like introduction, boundaries, then what is roof, what makes roof, what makes floor, content and applied. So on the cubital fossa, first of all, what is the introduction part? So let's start. Introduction part. What is cubital fossa? Cubital fossa is a triangular hollow space situated in the front of the elbow. In the front of the elbow there is a hollow space. This is the in front of the elbow there is a hollow space. This is a humerus bone. Here is a radius and ulna bone. This is the front of elbow. This is the elbow joint. This makes elbow joint. This is the front of elbow, on which cubital fossa there is a hollow triangular depression. This is known as cubital fossa. This triangular depression is known as cubital fossa. And what is the boundaries of cubital fossa? The lateral side, medial side, its base and its apex. Let's see here boundaries of cubital fossa. This is the front of elbow joint. Humerus bone, radius and ulna bone forms a elbow joint. This is the front of elbow joint. This is a triangular hollow space. This is known as cubital fossa. This is the medial side and this is lateral side. On the medial side there is a muscle known as pronator teres muscle. On the lateral side there is a muscle known as brachioradialis muscle. In the medial side, pronator teres muscle has two borders. This is a medial border, this is a lateral border. On the lateral side this is a lateral border. So on the medial side, cubital fossa is formed by the lateral border of pronator teres muscle. Let's see on the lateral side. On the lateral side there is a brachioradialis muscle. It has two borders. This is the medial border and this is the lateral border. So on the lateral side of cubital fossa is formed by the medial border of brachioradialis muscle. Okay, and this is the base. This is an imaginary line. Joining the two epicondyle of the humerus. Humerus have two epicondyle, and the line joining the two epicondyle of humerus is formed base. On the apex, brachioradialis when crosses the pronator teres muscle. Here it crosses the pronator teres muscle, and this crossing is formed apex. This forms apex. So this is the boundary of cubital fossa. What makes lateral side boundaries? This is a triangular hollow space cubital fossa. This is a medial side. This is lateral side. From the medial side there is a muscle. This is pronator teres muscle. This muscle is known as pronator teres muscle, and this pronator teres muscle has two borders. This is medial border and this is lateral border. This cubital fossa is formed in medial side by the lateral border of pronator teres muscle. On the medial side, this is formed by the lateral border of pronator teres muscle. Let's see on the lateral side what makes lateral boundaries. The lateral side there is a muscle. This is known as brachioradialis muscle on the lateral side. On this lateral side, this brachioradialis muscle have two borders. This is the medial border. This is lateral border. Okay, this medial border helps in the formation of cubital fossa in the lateral side. On the lateral side, it is formed by this is the medial border of brachioradialis muscle. Okay, here is the written. On the lateral side, this is formed by the medial border of brachioradialis muscle. On the medial side, it is formed by the lateral border of pronator teres muscle. This is the medial side, and it is formed by the lateral border of pronator teres muscle. And base is formed by the imaginary line. Joining the two epicondyle of the humerus. This is the humerus bone, and this is the two epicondyle, and this is the imaginary line joining the two epicondyle of the humerus. It forms base. And what makes apex? It is formed by the area where brachioradialis muscle crosses the pronator-teres muscle. This brachioradialis muscle crosses the pronator-teres muscle, and this makes apex of the cubital fossa. This is the apex of cubital fossa, this is base of cubital fossa, and this is the triangular depression. This is the cubital fossa. What is the roof? What makes roof of cubital fossa? Roof is formed by skin on the upper side. On the upper side, what is it? On the upper side, on the uppermost part there is a skin. Uppermost part there is a skin. Then superficial fascia. Then deep fascia. Then bicipital aponeurosis. Upper side skin, superficial fascia, then deep fascia. If we remove deep fascia, then we will found bicipital aponeurosis. After that we will get cubital fossa. And what makes floor? Is floor is formed by on which cubital fossa is suspended. That is, this cubital fossa floor is formed by the brachialis muscle and the supinator muscle which surrounding the upper part of the radius. What makes content? What is the content of cubital fossa? That is its code in mnemonics is MBBR. That is median nerve, brachial artery, biceps brachii, and radial nerve. This is code MBBR. Median nerve, brachial artery, biceps brachii, and radial nerve. This is the content of cubital fossa. Content of right cubital fossa mnemonics is MBBR. This is the MBBR. It is the MBBR. This is median nerve. This is brachial artery, biceps brachii, and radial nerve. This is the content of cubital fossa, and this makes boundaries on the medial side, pronator-teres muscle. On the lateral side, this is brachioradialis muscle, and in between them, it is the content of cubital fossa. That is the MBBR simple tricks. On the last point, what is the applied and clinical significance of cubital fossa? That here is a brachial artery. Here is a brachial artery, and brachial artery is responsible for the measuring the blood pressure. The blood pressure is universally recorded by auscultating the brachial artery in front of the elbow joint. That is, this is the most important clinical significance of cubital fossa, that is brachial artery. This is all about cubital fossa. This is all about cubital fossa. University exam, we have to write 2 pages. In 5 marks question, we have to write 2 pages. This is the enough. This is the enough for cubital fossa. It is 1 page. This makes 1 page and 2 diagrams. This will make 2.5 pages. This is the enough for the university exam for the 5 marks question also. Okay, and cubital fossa. Okay, thank you.